Well, for many healthcare clinics, federal grant funding is a crucial resource to keep doors open. In many cases, it can make up a sizable chunk of their budget. One organization tells our Josh Maxwell that they narrowly got the green light for renewal this year. He's here with me now. And Josh, if you can, give us an idea of really just how important this grant money is to those who serve our community.
Well, Mike, Section 330 grant funding is a resource that helps health clinics around the state provide affordable resources to the community. Now, for Amistad Community Health Clinic, it makes up roughly 20% of their operational budget. They say without it, they might have to scale back services. For many in the community, health clinics are an essential bridge for those who may not be able to afford regular health care. Amistad Community Health CEO Dr. Eric Baggerman says 330 grant funding plays a large role.
The federal government has the 330 grant set up to help community health centers across the country, 1,500 community health centers, to be able to take care of everybody without insurance.
Baggerman says that funding, while needed, doesn't come easy, saying the renewal came on January 22nd and was set to expire 7 days after on the 30th.
It regularly needs renewals. This is not funding that is done and continues on for a 5-year period. In fact, over the last few years, it's been renewed for 6 weeks or 3 months or, longest period of 9 months.
Baggerman says without that funding, operations would look very different.
It makes up between 15 and 17% of our budget. So while it is not half of it, it is certainly very important because many of the things that we do with that money, there's no other funding for.
But it's not just Amistad who depends on 330 grant funding. Bill Holscher, who is the CEO of the Coastal Bend Wellness Foundation, says those monies are a lifeline for their operations too.
What we have noticed over the last 2 years is that the need for community health centers has increased significantly.
Holscher says while they are currently renewed for funding, if that ever went away, the community would feel the impact.
Funding has not increased in many years, but the need has increased. Not just devastate our agency, but I think it would cause significant issues in the community because that would be, over 4,000 people who no longer are able to access medical care.
Now again, both agencies do have their 330 grant funds in place, but both told me they have to submit annual reports showing exactly how they serve and aid the community. Mike, back to you.